Hi everyone, today we're gonna discuss three preventions to prevent or reduce the asymmetrical face, improve more symmetry in your face with Dr. Afzali. Yay!
Hello,
Functional
everyone.
dentist, which is different from regular dentist. So if you haven't watched the previous video, please do, because she talked about the three kinds of asymmetry, and it's very, very important to know that you understand this before you watch this video. But in assuming you watched the previous one, let's do it. So tell me about the three kinds of preventions for asymmetrical face.
Yes. Basically, the first step, even before you start the prevention concept, is the diagnosis, is you understanding that what is the situation. If you're healthy, that would be one thing, but if there are things that are not aligned, they need to be fixed, and then we move forward. But diet is one of the most important factors. You want to have a nice, solid, chewy diet. Fresh, raw vegetables are the best thing to not only uh, start building the facial symmetry, but also to know if there are any disharmony in your system that doesn't allow you to chew this. And one of the tips that I give you is that when you start chewing and trying to use both sides, you can see if one side the jaw gets tired or you get pain. It can be sharp pain, it can be just fatigue, or it can be sensitivity on the teeth, or you can see that one side is chopping the food much more efficient than the other side, and you're leaving bigger pieces on the other side. So these are the things that you basically, by starting using the chewing, the foods that require chewing, not only you start enhancing your facial symmetry, but also you reveal for yourself that what is the level of the health of this system.
So you think like it's better to eat something a little bit harder so that we chew more?
Absolutely, absolutely, because this system that we have, our whole jaw, the masticatory system, this bone and these teeth become more stable, and the bone density works by loading it. We want to load our teeth, we want to load our jaws, so we will it's a workout. The same way that we build muscles in our shoulders, in our arms, in our legs, the same concept. We load the upper and lower jaw, and then build the foundation, and of course we get the supporting muscles. We build the muscles. So
Okay,
that's
so
the first
one
step.
of my face posture is how to eat. And I always say eat bite into pieces and 50%, 50%. And then I like doing like almost like biting with the cheeks, because I see people eating, including me, but this one, and then this really cause the pain in the TMJ area, and this overworking muscle is always So I like eating up. What do you think about that?
Absolutely right. In fact, you're so right on causing TMJ problem, because that type of chewing, like I would call it sad chewing.
Oh, sad chewing. That's a good one.
It just came to my mind, because when we are eating, we might as well enjoy our food and, have things lifted. Because that itself, you see, every time that we're doing that, this is the TMJ, this is the conduct. We're pulling it out, we're pulling it out, we're irritating it. So that is the reason that you say that people start having discomfort.
Okay, okay, that's good to know. Thank you.
Yes, sure.
Um, the next one was habit.
Yes, absolutely. And you are, this is exactly your field of expertise, and I am uh, really impressed with all the tongue posture exercises that you have, and also with all the tips that you have. I would say that your viewers can benefit a lot about that. You know,
Mm,
having the habits of the tongue on the roof of the mouth, the palate, and keeping the tongue in the vertical position,
mm,
that is incredibly important. It is a way of preventing the facial asymmetry because we are using the 50-50% both jaws and having the tongue in the right position.
mm.
That
Yeah.
itself is a great preventative measure.
Mm. I realize myself, this is palate, this is tongue, and this is
Yeah,
teeth. So when every time I eat, it was like this side, only
yeah,
this side. And of course, you're gonna get asymmetrical um, face. So I learned that when you the cheek is the chewing mm, 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 should be in the middle. That's what I learned. What do you think?
exactly, absolutely. And I can show it to you on the model.
Mm,
This one away. So if you look at this model, that shows that
mm,
the tongue is not just the part that we see. We have a strong base of the tongue,
mm,
and this strong base of tongue is so crucial to be elevated, to be vertically positioned, and this be against the palate. And if you look at it, it is a wide area, is not the tip of the tongue touching the palate, the entire surface of the
mm,
tongue
mm,
touching the palate.
mm,
And you know, that's a whole different subject of how it helps in opening up the airway, and the effect on endocrine system. It just is fascinating to know how much knowledge and science is in this area. And
mm,
we can really use it to our advantage to have beautiful faces, to stay younger. And one thing that I want to say, all these tips that I'm giving, you can use at any age. It doesn't matter if you're a teenager, if you're 30 years old, if you're 40 years old, if you're 60 years old, 80 years old, you can use this to your advantage. And those tongue posture tips that you have, or your training, what it does is that when we enhance the habits, and then also our chewing is happening properly with the balanced bite, they help each other. You know,
mm,
we get a snowball effect.
mm.
So these are, yeah, if you're doing facial exercises, is great. Check your bite, make sure your bite is correct, make sure the foundation is correct, and then your chewing is going to add to your exercises.
Mm,
You get
mm.
a snowball effect.
Yeah, because we eat something every single day.
Absolutely,
Yeah,
absolutely.
that's great. So any age doesn't matter if you are 60 years old, 50, 20s, you can change, improve.
Absolutely. And you, we have to look at it with the right perspective. Of course, we're not going to change a skin and the muscle tone of the 80 years old come the same rate that we're going to be doing at the 40 years of age. But when we look at it, the way that I am looking at this is that we can enhance the quality of digestion, we can enhance the quality of life, we can open up the airway, we can open up the pharyngeal space and making the swallowing better. And all of these are going to have an impact on the facial structure.
Mm,
So we get improvement from the starting point, whatever starting point is, we will get improvement. One thing that I want is that I believe when people have hope and when they see, they think that things are possible, they will work on it. And that's where the miracle happens. That's where the magic happens. But if we have these preconceived ideas that age is against us, and if we are older, then we should give up and not looking at these things, and these are just for young teenagers, then we're missing the boat. And that's not the purpose of it.
Okay, that's amazing. Great. Thank you. So the third
Sure.
one is exercise.
Yes, we talked about exercises that basically I would say the importance of it. That if we look at this system, we have the one box, which is the nasal box, we have the oral box, and then we have the pharyngeal box. These are made of the very same tissues that we have in other parts of our bodies, muscles, tendons. And if these muscles are not worked out, if they're not using the whole chewing part or mastication part to their advantage, they're going to start losing tone and then they go south. So by exercises, we can raise the awareness into our build awareness into our muscle memories. You know, these
So
muscles have memory. Yeah.
you mean that, so the exercise you mean is chewing properly. Is that the exercise you're talking about?
Yes, the exercises would go, as I mentioned, you can start, I would say the starting point is utilize your chewing as a basic exercise,
Oh, okay, okay.
proper exercise. And then if you are want to go further, which I think it's a great idea, learn about the next step. Most important thing is tongue posture. On posture and eating posture, like just the position of our neck, how it affects the jaw. You know, Coco, this is a very, very elaborated subject, and we can have maybe about 50 videos
Oh,
to
okay.
cover all these areas. And I love to provide as much education as possible for your audience. And but the main point is just don't give up. Sure, don't give up, and don't ignore. One thing that I highly recommend, if you are not able to chew well, don't go south and start using this hard food, soft food. You know, soft food is just like accepting a limitation and then going to that level. Because guess what happens? The next level is that you're going to lose that ability also, and then go lower and lower. Like it's just anything in life. When you're facing something that is not working, try to figure out, try to solve the issue. Don't try to be complacent with it, and choose an option that is easier. I'm not saying ignore your problems. I mean, if you cannot really chew, accommodate yourself, but find a solution. Go for the optimum situation.
Okay, thank you so much. So in summary, there are three preventions we can do to create more symmetrical face. One is a diet. So don't eat just soft food, but more hard one to,
Yes.
to practice the biting, chewing. Then number two is a habit. So tongue posture, the how to eat in a symmetrical ways, always the tongue in the palate middle. Look, those kind of habits, so important. Eating posture, tongue posture when your face is resting. And number three is the exercise. I mean, it's a similar thing, but every time you eat, every time you rest your face, remember the good tongue posture and the eating posture all the time.
Yes.
Okay.
Great.
Great. So those are the three prevention methods. In our next episodes, we're gonna talk about how to is wisdom teeth extraction is good or bad, or how to diagnose. And we're gonna ask the opinion to Dr. Afzali. So stay tuned. Thank you so much.
Thank you.
Bye.
Bye bye, everyone.